Joining me is a friend of the show. He played in the NFL and became a radiologist when his mom was diagnosed with cancer because he wanted to figure some things out. So I wanted to have somebody on who is hell-bent on figuring some stuff out. We're going to have a conversation today. Let me welcome to the Karen Hunter Show, Dr. Herve Damas. Welcome.
Hey, what's up, Karen? How are you?
I'm good. Now, you're in Florida, right?
Yeah. Hold on a second. Where's my applause?
No, it was there. It was there. Brittany gave you your applause. I heard it. It was short. It was short. All right, but Britt, give him more applause because he apparently needs it.
That's right.
All right, there you go. All right. What's the climate? What's the climate like in Florida around the coronavirus? Is everything shut down? Is it like it is up north here?
So I'm down on Miami Beach, and we've got a weird situation going over here. It's spring break, so we got a lot of young people down here who came down to enjoy themselves and party and haven't really been paying attention to the guidelines set forth. And you also know Florida, has a reputation of being a little kooky, for lack of a better term. So some of the citizens in the state of Florida have that kind of, rugged individualism or whatever, kind of mentality where they're going to disregard common sense and go off on their own. So we're dealing with a lot of that down here. But slowly but surely, I think the tide is turning. I think the local municipalities and governments are doing a good job at messaging and trying to bring some of that in.
Now, I know you were vigilant last week when people were not, and this is why I wanted you on, because you understood something about this virus that I think not even a lot of medical professionals, and you were really vigilant in making sure that you're getting information out to your patients and being extra careful and cautious. What did you understand last week that people are just now getting to today?
So early on, I think it first popped on my radar early January, when we first got the news of what was happening in China. And I started noticing some anomalies, which is just like, hey, this is not the traditional thing, right? So this is coronavirus. They call it COVID-19. The 19 stands for 2019 because I think the first diagnosed case was like December 30th, right? But there have been seven iterations of the coronavirus. So we kind of have a pattern of how we react to them and how they kind of spread. And we've had this happen before. And the first thing that popped into my mind that was weird was the Chinese government's reaction to it. And it was just like this lockdown, and they built this incredible hospital in a short period of time. And they didn't do that for any of the other, corona-type viruses or any of the other pandemic-type viruses that we had before, H1N1, SARS, and MERS, and those kind of things. So for me, I was like, man, that's really progressive. The Chinese, look at them. At first I was like, whoa, look at these guys. Look at them getting out in front of things. Go ahead. And then slowly but surely, you started hearing that the numbers coming out of China weren't reliable. And so I started putting those two things together and hearing amongst the medical community like, hey, man, those numbers aren't right. And then once it spread to other parts of the globe, the growth curve didn't really align with what we would traditionally expect. So we had this kind of exponential growth and spread of this pathogen, which didn't follow the traditional patterns. And that's when I was like, whoa, there is something going on here that is really anomalous to what has happened in the past, because we have this blueprint from the previous, previous iterations of the virus or other, pandemic kind of pathogens. So that's when I was like, there's got to be something here that we don't know about, and our government is really being slow-footed. And slowly but surely, as information has come out, we found out that this, unlike the others, has this long incubation period where you can be a carrier and asymptomatic for up to 2 weeks without having any idea. And while you're walking around thinking everything is great, you're spreading it. And this is not traditionally the case in these things. They usually have a short incubation period, you get sick as hell, and then you die. Whereas in this case, it's kind of like, hey, I'm going to hang out inside of you and hide inside of you and let you spread me to everybody else. Then I'll get you sick, and then I'll take out the weakest among you. And so once I really felt confident about saying that and looking at the numbers, I was like, listen, we better protect ourselves, because there's something going on here that we are not prepared for. This is new for us. This is really like a hidden kind of stealthy enemy that's taking advantage of our lifestyle.
So knowing that, right, and the slow way in which, and I don't want to get into politics, but there's a wave of people out there that feel like this is a hoax, or because we don't see hospitals piled up yet, that people are overreacting. And in that period of time, the almost 2 weeks now, what do you expect is going to come next? And I don't want to scare people, but just based on because you, again, from the beginning, you have called me and was like, this is serious. What do you think is going to happen next?
Yeah, I've been telling all my people that I know and all the people I care about on social media. I've been like, listen, you guys, the number one thing that I always try to do is not outsmart myself. And I know there's limitations to that, what everyone can do and know. So I kind of try to pay attention to what smart people or experts are saying, right? So if the expert is starting to say this, it would be foolish of me to think that I know more than that person. It would be foolish of me to start blowing them off. All of a sudden, this person who's been very grounded and measured in what they've said throughout their professional careers and life, all of a sudden would just lose their mind and go off the deep end. That doesn't make sense. So most likely, they're telling you what they know based on their expert opinion. So what they've been saying, number one, is exponential growth. That means this thing, one report said he had it doubling every 7 days or so in Italy, right? So right now, Italy is a great example of what happens when this thing is left unfettered or unchecked, right? They've got this just explosion of cases that they can't handle, right? It's overwhelming the system. And so people who would normally be able to get some sort of care, supportive care, can't, because there's a finite number of resources, there's a finite number of personnel. You just can't handle it all. And as a result, you start to have deaths and you have severe cases. And this is what we're trying to prevent in the U.S. Unfortunately, our response has been so slow that we've now they're coming out without saying it, but saying the devil's already in the house, right? I mean, that's pretty much what they're saying right now. Like, hey, we've already let it in, and now we're going to try to minimize the damage that it's doing. So that being said, we're listening to the experts, right? Don't listen to, the people who are coming up with crazy ideas, but listen to what the experts are saying. They're telling you, listen, the only thing, they're literally telling us, the only thing that we can do right now is to try to stop spreading it. So stay away. That's it. They haven't told us anything else.
There's no cure. I saw
cure.
That there was some vaccination or something that Trump was trying to, because Germany, this company in Germany has a vaccine. Trump was trying to sneak and buy the company, which I thought was weird. The lab that is the only lab that has apparently some sort of vaccination, but the German government found out, and they told reporters on Sunday that the administration was looking into how they can gain control over this vaccine that was developed by a German firm called CureVac. And Trump offered funds to lure them to the United States, and the German government was like, stop. But there's even the vaccine, though. It's scaring a lot of people, like the notion of a vaccine for something so quickly, when even the flu vaccine doesn't kill the flu strain that is right now. So how do we know that this is going to actually work?
All right. So quick thing about vaccines, like the flu vaccine. The flu vaccine is based, the seasonal flu, right, which is influenza A, that's what we're referring to, originates in Asia every year. And what we do in the U.S. to develop our vaccine is to look at the strains, because these viruses do mutate over time, right? So even even the coronavirus, there are two strains of it right now. There's an L and an S strain, and the L strain is a strain that is really spreading itself across the globe right now. But the vaccine for the flu virus, we kind of see what's going on in Asia, and then we have our scientists make an educated guess as to what's coming over here, right? And they say, well, this is what's happened before, blah, blah, blah. They put in their numbers, and they say, this is our vaccine. We're going to take these dead viruses, and then we're going to do this, blah, blah. They do their magic, inject you with it, and then now your body has a pathogen that is inactive, but then it can fight against. So then when you get the real thing, you've already developed defenses. But it's not foolproof, right? Because people still get the flu vaccine and get ill. Now, the vaccines that they're working on for the coronavirus, this is like basic level stuff. They don't they're not injecting live or dead viruses into anybody at this moment. Nothing. So that's impossible. There are steps that you have to go to in order to protect human beings. You can't just jump in and start doing that kind of work, right? So what they're looking at right now is using some pharmaceuticals and things that we know before that have antiviral properties, right, to see if this is the start, we can use this as a foundation to lay something on top of it. But we're looking at least, man, I want to say at least, if I would be say 18 months to 2 years before you could have something that you can really prove would work, and then, of course, you'd have to study the side effect profiles. So there's nothing that's going to come out at all anytime soon as a vaccine or preventative measure. Nothing. So you can put that one to rest.
I have one of my favorite doctors on with us right now. I have two of my favorite doctors on today, but this is one of them, Dr. Herve Damas. We're talking about the coronavirus, but we're talking about habits and what we can do next and what he sees in the future. Before break, you were saying the vaccine, probably for another year and a half to 2 years, we won't really know whether there's an actual vaccine that's working.
Correct.
So what do people do? I mean, if there's no cure, you're right. We have to, not be around other people. What are some other things that we can do to, stay safe?
Yeah, well, so we have to remember too, right? The thing that we're really concerned about, is the fatality rate, right? The case fatality rate. The case fatality rate the case mortality rate is the number of confirmed cases and the number of deaths to those confirmed cases, right? And what we're finding is that number is just creeping up higher and higher from when it was originally announced in China to now. It started at 2%, then went up to 3.5%. Now some numbers are saying 6-7%. And so that case fatality rate really applies to, and many of you have heard this already, are the sickest and the weakest of us, right? Those with pre-existing conditions, cardiovascular disease, uncontrolled diabetes, pulmonary diseases, autoimmune diseases, those type of things, right?
Why is that? Why? Because you don't have the soldiers to fight?
Yeah, so there's two parts of that. Number one, what you just said, that your body is already in a weakened state, right? It's already fighting something that, it's losing to. Right? So you add basically another army to the battlefield on another front. It just can't fight it off. Number two is some of the data coming out from Asia. The scientists there are saying there is an immunosuppressive component of this virus that they're trying to investigate, but it seems to decrease T-cell response, which are the cells that come to fight, like those are your Marines that come and fight the battle for you. And so it decreases that. And then as a result, you get this terrible pneumonia.
So wait. Dr. Damas, you're telling me that a virus has mutated to the point where not only does it lay dormant long enough for you to spread it to as many people as possible, but it also has a suppressant to suppress the very thing in your body that would come and kill it.
So that's what they're saying right now. And, that's what some of them early reports are saying. They're trying to figure out why this thing had such a very serious fatality rate, right? Case fatality rate compared to, the seasonal flu.
Right.
And of course, when you compare it to the seasonal flu, let's keep this in mind. Like I mentioned before, the seasonal flu, we have a vaccine. We have like a template, blueprint, and we have meds, we have Tamiflu. You come in as soon as you're in. That's going to decrease the severity and course of that. So the seasonal flu, could be much worse if we didn't have what we had for it. The reaction by the body is weird, where you just get this really fulminant, pneumonia that just fills your lungs up with fluid, and people go to acute respiratory distress, or the ARDS, and then that's what leads to death.
Oh my
right?
God.
And it's just like, how is that happening?
Right.
Because it doesn't happen that quickly in a normal kind of influenza.
In nature.
Yeah.
This all right.
Yeah.
I'm not going to say anything more, but let's take some callers. No, we're not going to go there. We cannot go there because it's irresponsible. Yeah. Let's go to Donald. You can, and I'm not going there with you. Donald in Illinois. Welcome to the Karen Hunter Show. Hey, Donald. Come on.
Donald from Washington.
No, he's in Illinois. I see him. All right. Hey, brother. Funny.
Good afternoon, Karen, and to Dr. Damas and the rest of your crew, Karen. My question is kind of twofold. Hello, can you hear me?
Yes, we can hear you.
Okay, great. So there is a lot of talk about pre-existing conditions, and I happen to be hypertensive, but it's controlled. I'm wondering if hypertension is one of the pre-existing conditions. And the second part of my question is, I operate in a job where I am I'm a delivery driver, and I come into contact with at least on a daily basis 120 or so people a day. Based upon what has been said, there can be carriers that don't appear to be sick. So what can I do to protect myself to kind of beef up my immune system? I do take vitamin C every day, but what else can I do to help protect myself and my family?
All right, really good question. So hypertension alone is not going to put you in the high-risk group. If you had poorly managed hypertension, which is either secondary to another condition or poorly managed hypertension that has caused something else, like congestive heart failure or something like that, arrhythmias, things like that. So if your hypertension is is well managed with medication and you don't have signs like shortness of breath, fatigue, or dizziness, lightheadedness, you're not in the high risk group. Right?
What technically is, Dr. Damas, hypertension? What is it, and what does it do to your body?
All right. So hypertension is elevated blood pressure. The normal range for blood pressure is 120 over 80, and what that is a comparison of the blood pressure leaving your heart to push blood out of your heart through your blood vessels to get it to your body, your brain, and your organs and cells. The higher that is, that means that your heart is working super hard to get that blood out. It's meeting resistance, right? And so there's a cause of that. Some of it is genetic, but oftentimes in our society it's a result of lifestyle and diet choices, right? And so as you continue to increase hypertension, what you do is it's like having a garden hose where you're squeezing part of the garden hose, and you know what happens to that hose over time, right? It starts to kind of swell up at one end. Eventually, it'll burst, right? You can have aneurysms, which is when it swells, and then the aneurysm can rupture. And then on the other side, you're not getting enough blood flow, right? You're getting this high velocity blood flow, but it's inadequate. So you cause, cellular death and dysfunction of organs and systems. You lose your sight, your kidneys start to dysfunction. So it has like a series of things if it's poorly managed, right? And so then now you start having like, oh man, I've got renal failure as a result of poorly controlled hypertension.
But on medication, everything's flowing well, so he's not at high risk. But now they've said
if he's saying he's well managed, right? So
But he's in contact with more than 100 people, and the number of people now is
the second thing. Yeah.
Right.
So he's in a high risk kind of vocation. He's getting in touch. So you've got to pay attention to not only, and this is something that I want to stress to everyone. Don't just think about yourself. Think about the fact that you are part of a community and that we've got to look out for one another, right? So don't just look at, I'm just going to protect myself. You've got to protect the person next to you, your family, your loved ones who may have, because if you become a carrier and then you go home and then you spread that, now you're putting that person at risk, right? So don't just think about like me, right? It's like, what am I doing to make sure that I don't harm my brothers and sisters, my mother, my father, those kind of things. So in your particular position, I would wear gloves, right? I would wear gloves all the time. I would sanitize and wash my hands regularly, right? I would keep myself, make sure that you don't cough into your hands. And I tell my staff, and I do this all the time. I'm turning into like some people's moms. Whenever I see somebody doing something wrong, I'm like, hey, don't do that. Coughing into your hands. What's wrong with you? Go wash your hands, right? And then you're looking at me like, oh, Mom. I'm like, yeah, oh, Mom, whatever. You're not taking me out. Let's go clean that baby up. So we've really got to be stewards of our environment and make sure that we are following the precautions. What they're telling us, it may seem silly, but that's our best chance. Cover your mouth when you cough with a tissue. If not, use your sleeve. Don't ever use your hands. Don't cough into the air, right? The other thing that we started doing, right, and this is not something that they're recommending, but in the clinic, this is what I do, is I have my staff cover their mouths and faces with a mask because we don't know if we're carriers and we're coming in contact with people who are already sick and already ill, and it would be really negligent of us to just willy-nilly, I don't know if I'm a carrier. None of my staff knows at the point. And then, to have these people come in to see us and then putting them at risk. So I've gone one step further and say, listen, I've got to be really careful about what I do to the people around me that come in contact with me.
Well, thank you. And Donald, be safe out there.
So the back end of my question was, what can I do to boost my immune system too?
Okay, so
and further protection.
Your immune system is self-regulating, right? And you can actually decrease, you can help or hurt it. The number one thing is diet, right? So make sure that you're getting enough a well-balanced, nutritious diet. The fact that we have to take supplements in a lot of cases speaks to a greater issue with our Western diet and that we're not getting what we're supposed to get from our food. If you got to supplement your food with some other things, that obviously your food is not as nutritious as it should be. So it's number one. Number two is rest. A lot of us work a lot of hours. It's like the American way, grind. Sometimes you're working 2 jobs, but you've got to sleep because that is when your body does all its healing and recuperation. Number 3, mental health, stress, anxiety. Those things secrete the stress hormone called cortisol, which is actually it's counterproductive to your immune system. It actually breaks you down. So if you're like stressed, you've got to find ways to relieve that stress and that anxiety and bring everything down to another level. So mental health is important. Physical rest is important. Diet and nutrition.
All right. What about working out?
Thank you so much for great information.
All right. Thank you, Donald. And be safe out there. Yeah, working out, because that can both stress you.
Yeah, and don't start a strenuous workout program now. Now's not the time to try to get shredded for a beach, right? Right. So yeah, man, we got coronavirus. I'm gonna get ready for the summer. No, don't
relax.
Do that.
Relax.
Yeah, chill out. Right?
Do yoga in a nice sauna, like just not at the gym though. Not at the gym. Not around people.
Do not break yourself down.
Yeah.
I haven't gone to the gym in a week. And
Are you doing it?
The gym. I actually use the gym in my condo, but I haven't gone to like my main gym in a week. I just been kind of chilling. Again, I just feel like I can't afford to be the person to either get sick or to be a carrier and give it to people. So I'm kind of like really cautious. It's just I just feel that responsibility.
And
so I
wish
gone in a minute, staying at home, using the gym at home.
I wish more of us. Today is hashtag unity, which on the Kwanzaa calendar is today, right? Monday is unity. If more of us felt that way, if more of us were our brother's keeper and thought, it's not, I feel great, but I don't want to be the cause of somebody else not feeling great. Like, and that should be across the board. Like, this should become a habit. I don't want to be the cause of anybody else's pain.
Correct.
I don't know.
Correct.
All right.
And realistically, nobody, again, there is no miracle cure coming. I know many of us are very spiritual and maybe hoping for a savior to come at some point. That may or may not happen. I can't speak to that, right? I'm not an expert on that. But until that, I always go with the old saying. They say God helps those who help those themselves, right? So you need to start really thinking about what you can do to help your brothers and sisters. I mean, what you put out, you will reap what you sow. And if you're sowing care and kindness and consideration and courtesy, that's what's going to come back to you. If you're doing other things, I really believe that's what you're going to get. And so I think if we take care of ourselves and we make sure that we're vigilant of one another, we really become each other's keepers and do the right thing, we can decrease the impact. And so what I was saying before, I know you probably have to go to break soon, is that so we have this high-risk population. The rest of us are, the fatality rate for the rest of us, and we're talking about people over 65. Once you get over 65, you're in a high-risk category. These chronic conditions, you're in a high-risk category. So with the rest of us, what we've been seeing is something along the scale of like cold-like symptoms to a full-fledged flu, which, a flu really sucks because you're talking about missed days and you're feeling terrible. So you should tell people, right, the risk of you dying from coronavirus if you're in the main category is very low, but nobody wants to, like, I don't know anybody who's like, yeah, man, I'm looking forward to this flu next week. How about you? Nobody wants that. That's a terrible thing to be laid up in bed, and then spread that around your household.
Right.
So, so we don't really have to worry about mortality as much if you're not in that main group, even though that is a possibility. It is a possibility. So let me say, oh, man, Dr. Damas said I ain't got nothing to worry about. Say, give me 5, dap me up, give me a soul brother hug. Don't do that.
Okay, let's take one more call. Lene, because Gary in Florida, we answered your question about building up your immunity. All right, so you can hang up. But Lene in Virginia, welcome to the Karen Hunter Show. You have a question for Dr. Damas or Damas.
Yeah, Damas is cool.
Hi, Karen. Hi, everyone.
Hey.
I hope everyone is well. I had lung surgery a couple of years ago for what's called blastomycosis, and I'm trying to find out. I actually work where I am constantly in interaction with people and trying to figure out the best way to protect myself.
God bless.
Oh, nice. So when was the last time have you had any residual signs or symptoms, last sputum sample done, all that stuff is good to go?
In terms of no symptoms, I know typically I experience shortness of breath periodically, but that's not supposed to happen. I've been working out, and I haven't had any problems. No sputum issues or yes, in terms of the last test taken or anything like that.
All right. So here's a couple of things. So something our audience can pay attention to is the range of signs and symptoms. And they can be, like I said, very mild, from shortness of breath to just a general fatigue and malaise, headache. So you don't necessarily have to have the cough or a productive cough. You don't have to have the wheezing. There's kind of like a scope of symptoms. Again, you don't necessarily have to have a high fever. It can be a really low-grade fever or a mild fever that you don't even notice, or just plain old, man, I just feel really lousy the last couple of days. And so you can have this kind of spectrum of signs and symptoms, right, which, again, makes it difficult because we can all be carriers. So for someone like you, if you're really, really, really concerned, and if you're I would, protect myself, right? Wash your hands regularly. You know, one of the nastiest things, one of the nastiest things that people don't realize are doorknobs. So in our facility, what we know now with the coronavirus, right? We know that it can last in the air for 3 to 4 hours. It can last on porous surfaces for about 3 days, and we're looking at solid surfaces like stainless steel or granite for like 7 to 10 days. So making sure that we disinfect these surfaces. So you look at a doorknob, it's usually some sort of steel or brass or whatever. If you've got like nasty hands on that thing, then, it's going to lay around for a long period of time. So those solid surfaces are really, really tough. Computer keyboards, mice, they should be cleaned. And then at your place of employment, your employer, I don't know what their housekeeping schedule is, but if they're doing something that's less frequent, they should actually increase the frequency of the cleaning, specifically of the high contact surfaces and that. And you should really ask your employer if they haven't disseminated a coronavirus preparedness document, that they should disseminate that, and that should be updated every 1 or 2 days as new guidelines are being set forth. So you got to stay on top of them too. Don't let them slack on their job as well.
All right. Thank you, Lene.
That's one benefit. I don't go into an office, so thank goodness. But thank you very much for your information. I appreciate it.
Be safe. Dr. Damas, where do you get your information? Where are you being informed, and where can we follow up behind you?
All right. So I do a couple of things. First is cdc.gov. That's got the latest guidelines, and they're updating that as they put out new information. You can go CDC. The landing page on there is all coronavirus. Second, if you want something more local, go to your local Department of Health website. In Florida, we have, counties, and we have the State Department of Health. Those places will give you a little bit more information. The CDC is giving you like umbrella guidelines, whereas your local municipalities will tell you, for example, in Florida and Broward, we're starting the drive-through testing sites in the parking lots. There's one place in Broward that's starting in about 2 days. And so they can give you information on that, right? And they'll be able to tell you which hospitals, for example, have kits and what you can do. It's been a little slow, so you may be frustrated. I heard a caller say earlier she presented to the hospital and all this stuff happened. So there's been a lot of confusion, but slowly but surely, as the local municipalities and state governments have gotten involved, they're actually taking the lead over the federal government, which is good, right? They're leading from the front lines. So your local Department of Health, right? Now, if you want just like global information, the WHO, World Health Organization, can give you like a big picture of what's going on. World Health Organization. And
that was me being an asshole. I said who? All right, go ahead. All right.
What?
Who?
Mike Jones.
Yes.
So, and then the last thing that I like, and I don't know, this is just like a weird thing, Johns Hopkins University has this global map where they're updating every hour the total number of cases and the total number of deaths. And you can actually, it's really striking because they have this pictograph of the globe and the hot spots and where things are happening. So it's kind of telling you, it's giving you a picture of what's going on globally. And if you go on it right now, Italy is it's in really bad shape. Italy, I think, is close to 2,000 deaths. And, they've got a smart 2,000 deaths out of maybe 28 or 29,000 reported cases. And that's the other thing, right? The testing, like you mentioned earlier, the testing just tells us, it gives us data. It's not a cure. But hopefully, if we get enough data, then you can allocate resources and kind of formulate an attack plan. I'm more of a school of thought that, we kind of shouldn't do this blanket kind of thing. We should kind of like use data to allocate our resources more appropriately in areas that are either, densely populated, have a lot of visitors from infected nations, have maybe more concentration of at-risk individuals, and then target preventative measures and response teams to those areas, and kind of like, the other places that are maybe less densely populated, more spread apart, less risk, say, okay, you guys can maybe handle this on your own without us having to, just spread our resources thin and cover a lot of people. But, I don't make these kind of decisions.
No, but you're smart, and I want to, keep you close to us. Thank you for coming in today. We appreciate you. Dr. Herve Damas, you can follow him on Twitter. We've tweeted out his information. I'll retweet it during the break, but thank you for being part of this family.
Hey, man, thank you. Thank you for really taking your platform and what you provide to people really seriously. I think that's something that's really needed in our community, and it's a blessing to have people like you who really feel responsible to her fans, her audience, and brothers and sisters. I mean, we really have to look out for each other. So
absolutely,
anytime you need anything, I'll be here.
I appreciate that. That was enough applause too for you. So you got all of that. All right. I'll talk to you later.
Hook a brother up.
Thank you, Doc.